Mike Moore Media, the first place to hear Rockingham County news and information.
It's another Team Reidsville podcast, and on the line, Police Chief Robert Hassell. Hey, Chief, how are you, sir?
I'm doing fine, Mr. Moore. How are you?
I'm doing well, too. Thanks. Well, we have several things to talk about. Let's start with PORT, P-O-R-T. Tell us about that. What is that?
Well, PORT stands for Post-Overdose Response Team. That's something new here in Reidsville, which started July the 1st, whereas we're looking to try to tackle the opioid crisis here in our area here in Reidsville by following up with individuals who have had an episode or an overdose experience.
The PORT team is underway now, and for those that maybe don't come in contact with things like this personally, this is a continuing and increasing problem, isn't it, sir?
It is. Here in Reidsville, we started collecting data before around 2016, but more effectively in 17. So from 2017 to 19, we saw an increase by 119% of the number of overdoses here in our city, which was alarming to me and my staff. Mm-hmm. So the development of PORT is stemming from each of those years. We steadily saw an increase of overdoses that our officers were responding to in our community, and we wanted to do something different other than just responding, giving aid along with EMS. We wanted to do something different to try to give assistance to these individuals who need help.
Are we seeing any particular age groups, Chief, involved in these overdoses?
It's a wide range, but typically probably between the ages of 24 to 30 to 40 years of age. Mm-hmm. But we have seen it in all the age groups, but that is the typical age range we are seeing here in our city. Okay.
I know we're going through some challenging times now for sure on many different levels. Are we seeing more or less increases, or how does that stand? Has COVID-19 affected this, I guess I'm asking?
No, sir. These individuals who are going through crisis, through addiction, I have not seen at this point the numbers going on a decline.
Okay.
So, and I look at this as, with COVID-19, that has put a lot more stress, a lot more challenges on individuals and families. So, those who may be struggling with addiction, these additional stresses may be aggravating the causes of them to be addicted on these drugs. So I have not seen any evidence of our numbers going down, which is why our stakeholders involved with PORT to first include our primary service providers, Daymark and Integrated Healthcare. These are two of our service providers here in Rockingham County who are working hand in hand with the Reidsville Police Department with other community stakeholders to make sure this team is successful. And after every incident that we have an overdose in our city, we follow up with that individual with a visit to talk about the services and the help that's out here for them in the community.
And that is very important. That's what what PORT is all about, isn't it? That follow-through.
That's exactly what it's about. Before the development of PORT, we had already tried efforts in delivering that information. When we would go to an overdose, we would give a packet to the individual which would contain all the brochures from all our service providers in the county and in the city to just make sure they had that information to know who they could call, who they could reach out to, what services and resources are there for them. But then, we still saw the numbers going up, so we wanted to do something different. And so we looked at other examples of PORT in other cities in our state, outside of our state, and we felt it was time for us to try this here in Reidsville. And I am just so fortunate we have service providers who are willing to partner with the Reidsville Police Department to make this happen.
Oh, yeah, very fortunate indeed. Well, the team, you get a call, you get an overdose call, say at the police department there in Reidsville. How do you handle it from there? What kind of response time, things like that, Chief?
good question. When we get that first initial call, of course, the first priority is to get assistance to that individual. We respond, we assess the situation. EMS is usually either already there or they're there with minutes behind the police officer. And if necessary, if the incident requires it, all our officers have access to Narcan. We can deliver that life-saving medicine to kind of counteract the effects of the overdose. And many times that has saved many citizens' lives here in our city. So that's the first initial response when we get that 911 call for help. And then after that call, and of course we still leave that packet with the individual or a family member or a friend, whoever's there at the location. Well, within 48 to 72 hours after that initial contact, PORT is activated. We have made a commitment that this team will respond to follow up with this individual within that 48 to 72 hour time frame. And what that follow-up looks like is we try to make contact with that individual and see if they're willing to talk with us first, and if so, to explain all of the resources that are available to them to help them deal with this addiction. And then it's up to that individual whether they accept the help or they follow up with more contact for more information or not. That's the part that we were not doing before. We were doing passing out literature. We were going to the initial response and leaving literature. But we felt it was necessary to ensure that these individuals know that there are resources out here for them, and we care, and we want to help them break this cycle of addiction. So that follow-up after the initial contact is important. At least we feel it's important to make sure they know, one, that there's resources out here and that there are individuals in this community who care about them.
Mm-hmm. Yes, indeed. So far, how many overdoses have you responded to, Chief?
Well, since the beginning of PORT, we've had around 4 overdoses since the beginning in July 1st of this year. And as of this year, I want to say we're around 17 to 20 calls this year to date.
Okay.
So we're still tracking at this moment to be at the same number we are of last year. But hopefully, since the beginning, July 1st of this team, we're hoping to start seeing the trend go at least level off and then hopefully in time go down.
Mm-hmm. Well, it's good to know that PORT, Post-Overdose Response Team, is in place and helping in such a good way. So thank you for that update. I appreciate it. We'll probably talk about this again somewhere down the road and get a kind of an update again. I've heard a little bit about the After 9 campaign, but I'd like to know more. What is that?
After 9 started last year in 2019. We constantly have staff, especially our crime analyst, who monitors a lot of data, and that includes crime data. And we saw an increase in motor vehicle thefts over the last few years for 19, and then even still those numbers are tracking high this year in 2020. But when we saw those numbers last year, comparing 18 and 19, we saw a slight uptick in motor vehicle thefts. And this could be anything from a car or SUV, a motorcycle, or ATV. But either way, these vehicles, these items were being stolen. And it was alarming that the numbers were going up. So we started a campaign called After 9 to just as a reminder to our citizens here in Reidsville and surrounding areas to do some basic things. One, lock your car doors. Remove any valuables in the car. Anything of value, lock it up in the trunk or take those items out of the car. So that way, if someone is lurking around, looking in cars, they won't see those high-dollar items in your vehicle, tempting them to possibly break in your car and take those things. So we started this campaign last year, and we're still trying to push it out to our community. It's important for us to be diligent and be vigilant in protecting ourselves and protecting our property by just doing those simple things. Around 9 o'clock, ensure this is like a checklist in your mind. Have I secured my vehicle? Have I taken out the valuables, or have I removed them out of sight? And also just transfer this checklist to the home. Around that same 9 o'clock time frame, are my doors locked? Are my windows locked? Do I have my lights on outside if you keep the lights on for extra visibility and brightness? Just a checklist to do to better protect our homes and our property.
You use the term break-in, but really we make it so easy because we don't lock the car and they really don't break in. I guess it's considered that, but they just kind of open the door and help themselves.
Yes, sir, Mr. Moore, you bring up a very good observation there. Many of our break-ins that we do take, in some of our thefts of motor vehicles are left unlocked, and in many cases there are keys left inside, like at some gas stations or a convenience store. Citizens go up, they think it's going to be a quick go in and come out, and then they come out, their vehicle's gone. So we're just trying to ask our citizens to continue to work with the Reidsville Police Department and do our part and just take these basic steps to protect your property. Don't leave your keys inside a running car at a convenience store or somewhere public, around that 9 o'clock time, but this is good tips any time of the day. Lock your cars, remove valuables, and take them out of sight in the car by locking them in the trunk or the glove box, but best take them out of the car, period.
Mm-hmm. Make it really less tempting for sure. Exactly. Well, we have just a couple of minutes left, Chief. I wanted you to give us an update during this pandemic and how the city is responding, and particularly the police department.
Yes, sir. Thank you for that. The Reidsville Police Department, is working diligently to keep the citizens of our city here in the great city of Reidsville safe, as well as our officers and staff. Since COVID-19 began several months ago, we also have made changes by ensuring our officers have the personal protective equipment they need: N95 masks, gloves, even tie-back suits, sanitizer, and other personal protective equipment that they need to keep themselves safe, but also the public. We have done that by providing more services to the public. For example, to try to reduce face-to-face contact, taking reports over the phone, speaking with citizens on the phone when that's feasible. But we are still out here doing our jobs, trying to keep our city safe by responding to all calls of service, and just to make sure that we do our part. We're asking all of our citizens here in Reidsville to let's look out for each other as we have done for time and time before. Wear a mask in public. Not only do that for ourselves, but to do that for our fellow man. So we're asking everyone to remember those 3 W's. Wash your hands as often, for 20 seconds. Wait and keep that distance of 6 feet at least between someone else when you're in public. And as always, wear a mask, not only for yourself, but for your fellow man, to protect them as well as yourself. And, we believe that if everyone do that, follow those 3 W's, make sure we wear our mask in public, we are all doing our part in keeping our community safe. And that's what we're asking everyone to do from the Reidsville Police Department.
That brings it right down to Team Reidsville, right on the line, doesn't it?
Yes, sir, it does.
Okay.
Teams Reidsville all the way.
Chief, it's a pleasure to talk to you. Thank you for all of the good information today. And we'll talk again soon, perhaps.
Thank you so much, Mr. Moore. I'm looking forward to it.
Me too. Have a good week, sir.
You too, sir.
There's the Chief of Police for the city of Reidsville, Robert Hassell. You can get more information about the Reidsville Police Department on their Facebook page, Twitter, YouTube, and let me direct you also to riseupreadsville.com.